it's Dr. Garza. Today for my Tuesday talk, I want to give a brief video on a topic related to today, which is World AIDS Day. This is a heavy topic, we know, in medicine and in our culture, but it's such an important issue to know about and to know how we are involved with screening for HIV and AIDS. So many patients may not think of that related to their own care. Many of my parents and families don't think about how their family could be impacted by HIV. But part of our approach to preventive care is to screen patients for HIV. This is recommended by the American Academy of Pediatrics, the CDC, the U.S. Preventive Task Force, which are all societies and groups that provide guidelines for screening. And the current screening guidelines are to screen teenagers between the age of 16 and 18 for HIV. Of course, this is done with a blood test, and often the way I add this screening lab is to lab work that I order as part of a preventive well visit. So a large part of my practice, especially in the summertime, is to do well visits, well teen visits, and well child care. And through those preventive visits, we'll order labs to evaluate and screen for underlying issues. And on those labs, I include an HIV test in my patients between age 16 and 18. Now, after that, screening is really dependent on the patient's risk factors. Now, for patients that are sexually active, I typically would recommend doing an HIV test at least yearly. And then for those that may have even other risk factors, such as certain sexual practices, drug use, and other types of risky behaviors, then they may need HIV testing even more often. So that's something that we get involved in as well, depending on what's going on with our patients. The other thing that I will add on HIV testing, if it's due or if it's past due, is I will look at that when I'm diagnosing or screening for a sexually transmitted infection. So in my patients, I often will do diagnostic testing for sexually transmitted infections when patients have symptoms, and that's testing for gonorrhea and chlamydia, for example, or herpes. And so if those are identified, or if I'm screening for those, it's not screening, it's really testing for those, then I might add an HIV test as well. And then screening for STDs is kind of a separate topic, but that's also part of our preventive guidelines. It is recommended to screen teenagers for gonorrhea and chlamydia every year, and so that's added through a urine test with our lab work. And then, as I mentioned, if I'm doing testing when patients are actually having symptoms or they've had an exposure or more in that active stage of evaluation, then I might add on HIV testing at that time. So, thankfully, the HIV test is not one that's positive very often. I actually have never had a positive test in my practice with girls to women and young men's health, but it is something that screening helps prevent. It's an opportunity for us to educate patients about safe sex practices. It's an opportunity for us to talk about a negative result, what that means for them, how to stay safe, and how to limit their risk. And also just having candid, open discussions about healthy sexuality. The healthy sexual practices, vary, and parents may not feel comfortable talking to their teens about what's really going on. And so, often I have private time in patients' visits where I can talk to them about how to stay safe, how to, consider delaying the onset of having sex, how to limit their exposure by limiting partners, of course, condom use, and all of those different factors that affect their health related to their sexuality. So today for World AIDS Day, just want to remind you that I'm involved with screening for HIV, and that's just an integral part of preventive care in the work we do in adolescent medicine. Thank you, and have a good rest of your day.